Good afternoon, St. Helena community. I'm Mary Lou Wilson, your superintendent, and I'm joined with Kate Scudero, our school nurse. Hi, Kate. Thanks for joining me today. And
Hello.
Vanessa Cardenas, our interpreter. Thank you, Vanessa, for being with us. If you would like to hear this message in Spanish, then you'll just hover at the bottom of the Zoom screen and click on the world icon that says interpretation and go into that room, and you will hear the entire presentation in Spanish and the Q&A if there are any at the end of our presentation. So the purpose of today's meeting conversation is to update you and provide any guidance with regards to the changes in the COVID-19 protocols that seem to occur on a regular and ongoing basis. As you know, we've been through the last almost 2 years of COVID protocols, and we've worked closely with California Public Health and the Napa County Public Health to ensure safety and health and safety for our students and our employees. We do have a bit of a change, and we've been working through that change in guidance for the last a week or so, and we wanted to provide an opportunity to give you some additional details and answer some questions if anyone had any. So it's been challenging. The last year and a half, 2 years has been super challenging. We, as much as we want to be experts, as the guidance changes, we work to try and understand it and bring it to a level that all of our employees, our students, and you can understand. So a new guidance is posted on the district website. I'm going to share my screen, and then Kate and I are going to talk through the guidance and try and help to make some sense of it so that you can make sure that you're following it with regards to your children as an employee, if you're watching it, just anyone who's watching. Kate, can you see the guidance right now on the screen?
I sure can.
Okay, super. Okay, so Kate, there's some pretty dramatic changes with regards to the impacts of our students and whether they've been exposed or not. And so let's go ahead and talk through first this chart and then notification process, okay?
Absolutely.
So if a student is COVID positive, they know that they're positive, they've tested and the test indicates positive, and either they have symptoms or they don't have symptoms. Kate, what does that student need to do?
Well, I think a key thing that you mentioned is that the students may or may not have symptoms. We are seeing a number of people who are testing positive for COVID-19, and they may or may not be showing signs of that illness. What we would love for everybody to do as soon as possible and practicable, if you can let the school know when you get that positive test, and let them know the date of the test and or the onset of any symptoms if the student had them. And that way we can go ahead and communicate with the school and the school community about the onset of symptoms and whether or not there may have been an exposure. The student would then remain in home for 5 days, and that would be 5 days either from the onset of symptoms or from the date of the positive test. On day 5, they can retest using a rapid antigen test. And if that test is negative, then they can return to school as long as they are fever-free without the use of fever-reducing medications and their symptoms are improving. If there's no rapid antigen test available, then the isolation period, meaning the time away from school and from other activities, would be a full 10 days.
Okay, thanks, Kate. And that's an important point because we're working really hard as a school district to provide those rapid tests. So we'll talk more about that in just a little bit. And so then if the student does have symptoms and they're ongoing, what does the family and the child need to do?
If the student has symptoms and they don't know yet whether or not those symptoms are indicative of COVID-19, they do need to go ahead and get a test. They want to stay home from school, and reminder that we do still want parents to be checking in with their kids on a daily basis to make sure that they don't have any symptoms of COVID-19. And that's a tall order. There are a number of symptoms of COVID-19, and it's, sometimes they seem very, very mild. If your student does present with symptoms, we ask that you keep that student home. If you cannot access a test for to see if they're positive for COVID-19, then that student would remain at home for 10 days. However, if you do get that test and that test comes back negative, the student may return to school as soon as they're able. We do want you to keep sick students out of school, even if it's not COVID-19. If they have a terrible cold, we prefer they stay home until they're feeling a bit better.
Absolutely.
Mhm.
Anything more about that one with symptoms, Kate?
Simply just a reminder, fever-free without the use of fever-reducing medications and symptoms improving, and then they may come on back.
Sure.
And if they test positive, then you go back to the one up above where they remain out.
Okay. And, part of the updated guidance from California Public Health, this and I know this, is just that underlying goal to keep students in school as much as possible, because the risk of them being home is greater than the risk of them being in school. And so the shift that with regards to students who are exposed at school and are asymptomatic is quite a bit different. You want to talk us through this piece?
Absolutely. It's a really big shift, and we think it's a positive move in that we're keeping students in school when they are not showing any signs of COVID-19. So you may have in the past week or so received a notification that there has been an exposure, that your child was exposed to COVID-19, a student or staff member with COVID-19 at school. Because we have worked so hard to protect our community with masking and with caution around distancing, and masking and distancing are really the main issues. We have frequent hand washing and sanitizer available. Because we have all these protocols in place, we feel that school is a very safe place to be. So even in the event that somebody was in school and had since tested positive for COVID-19, students may remain in school as long as they are not showing any symptoms. So that's a big change, because previously we were doing quite a bit to make sure that nobody, if everybody was in school, sometimes we had kids sent home, and it was somewhat disruptive. The suggestion and recommendation, and what we are urging people to do, is if you do get those notifications, to go ahead and have your child tested. You can get tested at the school sites, or you can get tested out in front through N3 labs, either using a PCR or a rapid antigen test, and get your child tested to make sure that about 3 to 5 days after you get that exposure notice, just to make sure that they didn't become positive.
Right. And we'll talk more about those testing sites a little bit later. When you mentioned out in front, I know you were talking about Vintage Hall in front of the high school by the marquee on Monday, Wednesday, and Friday. And then we have testing sites at the primary school and RLS. So we'll talk more about that in a little bit. What if they develop symptoms after they've been exposed?
If they develop symptoms after they've been exposed, then we absolutely want you to keep them home. You go back up to the student has symptoms portion of our flyer, and they remain home. You get them tested. If the test comes back negative, they return to school when they're feeling better. If the test comes back positive, they remain home for 5 days. They get that test on day 5. If negative, as we hope, they return to school. If it remains positive, you can test again every day if you have access to the test until they can return to school. They just need to remain out for 5 days and then have a negative rapid antigen test before they return to school. If they continue to test positive, 10 days, after 10 days, the California Department of Public Health feels that it's safe for them to return to school regardless. So you have a 10-day isolation period, and then you return if you do not get a negative test.
Thanks, Kate. And we're all in our own spaces right now, so we don't have a mask on. In the minute somebody joins me in my office, or I'm out in the office space or on a school site, I'm wearing, I'm actually now wearing a KN95 mask. All of us are required to continue to wear masks in school. You want to talk a little bit about the different types of masks that that we recommend that they wear?
Absolutely. So we are finding that the masks, because we are remaining in class, that the masks are really, really important. And the quality of the mask, we feel, is protective of students and staff. If students and staff are wearing, sort of the hierarchy of masking, the N95 or KN95 masks, really well fitted, they have the wire under the nose, they loop around, they fit and kind of close off the airflow. Those are your best quality masks. Then the next on the hierarchy would be the surgical masks. And those are also very good. Not quite as protective, not quite as thick as the KN95s. And then the lowest would be the cloth masks. And I know that we all have collections of cloth masks in our homes now. And sometimes they're a lot of fun and the kids have their favorite characters and things on them. We are finding they are the least protective. And so, there are options. We have ordered masks for kids, the KN95. We have ample supply of the surgical masks for our students. We're waiting for the KN95s to come. If you want to have that extra layer of protection, you can double up. You can wear 2 masks. You can wear your surgical mask with the fun character mask that might be cloth on the outside. If possible, the KN95s really are the most protective.
Thanks, Kate. And then, if you haven't had your children vaccinated and they're age appropriate, certainly we encourage you to consider vaccination. St. Helena Public Health Hospital Foundation website has vaccine locations. I checked it out right before this meeting, and it looks like in February, every Thursday afternoon, they'll be at the Napa Up Valley campus offering first, second, and third doses. And so, really, we do encourage everyone to go ahead and get vaccinated. What if you're exposed in the community, not at school, in the community?
So there's a big difference there. And with the, as we talked about in schools, we have the masking, we have the social distancing, we have the hand sanitizer, and we're all being pretty guarded. When we're in our homes and in the community with friends, we tend sometimes to not have our guard up as much. And we do have some slightly different guidelines for that. And those guidelines are the same that they've been from the California Department of Public Health. There's the isolation and quarantine guidance. And that is for people who are fully vaccinated. If you are exposed and you remain asymptomatic, you may come to school. That hasn't changed. And again, none of these have changed. If your student is not fully vaccinated and they are exposed in the home, we need that student to remain at home until the end of their quarantine period. The quarantine period is, can be a tricky thing for families, especially if there are several people in the home who are exposed. If there is a person who tests positive in the household and the student has not yet tested positive, they have to wait until the end of that infectious person's isolation period, until they are no longer positive and they are beyond the 5 days to start their quarantine. So it can be quite a bit of time out of school. And that's one of the reasons we really highly recommend having your student be vaccinated. We do want you to very, very carefully monitor your child for symptoms, even if they are vaccinated, because we have seen some breakthrough cases. And so even if your child is vaccinated, if there is COVID in your home, we'd like you just to really monitor for symptoms. And then if there is, COVID exposure in the community and your child is not vaccinated, we need them to quarantine at home. And you can check in with the schools. And if you have questions about when they're allowed to return and how long is that quarantine, we're happy to help with that because it's awfully confusing.
Thanks, Kate. And the flyer that's currently on the screen is on the district website, and all of the blue font is a link to where our testing sites are, where, what the symptoms are, what a quality mask is, and the isolation and quarantine guidance. And so this flyer, this document is really helpful and can be found on all of the websites for the school district. So months ago, when year and a half ago, when the virus first started spreading and public health was involved, they were doing the contact tracing, and there was a lot of phone calls between public health and you. And it was very isolated contact tracing where, a few families were being specifically contacted and students were having to go home because they were exposed. That's no longer the case. And as you mentioned, we are now doing what's called group contact tracing. And so if your child's on a team and somebody on that team has tested positive, then the whole team is notified. If your child's in a class and someone in that class, so that the actual notification of exposure has increased, wouldn't you say, Kate?
It has increased, and that's because, as you mentioned, we're not just targeting the people who are within a certain proximity to the person who tested positive. We're contacting the classroom. So right. Everybody's going to receive that notification. And along with that notification comes the recommendation to have your student tested 3 to 5 days after you receive that notification.
Okay, well, you brought that one up again. So let's talk about where can they, what are we doing to help assist our families with testing, besides the free test kits that we gave out before school started in January?
So we recognize that the access to rapid antigen testing has been a real challenge, and that's especially difficult when the infection rate is so high. So we have accessed the professional kits that we can test your students at school. And the way we're doing that is we're providing the opportunity after school to have your child come to one of 2 locations to get a rapid antigen test. The testing is done quickly. We have ample staff, and once you're registered on the primary health website, and I'm sure you've probably all gotten some emails about signing up on that QR code with primary health to register for that test. Once you do that, you come in, you get tested, you have an email generally within an hour, an email and a text at times with the results of that test. So it's a really efficient way to get the information that you need for your students and your family's health. The locations, the times and locations for that, for this week, we've been testing Monday, Tuesday, Thursday, Friday. This week, we're at 2 locations for all 4 of those days. We're at RLS, and we were at the primary school, and we'll continue that on Thursday and Friday. And then next week, we're going to have we will be available every day, 4 days a week after school, Monday, Tuesday, Thursday, and Friday. But we're gonna provide options on both sides of town so that people can easily access that testing.
And so Monday and Thursday will be at RLS, and Tuesday and Friday will be at the primary school.
Yes, and those times are slightly different based on the times that the schools let out, so that we don't have people on campus when school is in session. So the Monday, Thursday time at RLS, testing will start at 3:30, and at the primary school, testing will start at 3 o'clock, and it'll go for an hour.
Okay, and then, so that's all rapid antigen. And I think it's important for our parents to know that our teachers, our employees have access to all of the testing as well. So whether they're exposed or they want to just check in on their status. And then if someone is interested in the PCR test and they're here in St. Helena, we mentioned that Monday, Wednesday, Friday, and 3 lab. You want to just double check me on that one?
Yes, Monday, Wednesday, Friday, 10 to 11:30, out under the marquee in front of Vintage Hall. And 3 Labs is continuing to provide that service. They've been just a great support to us in the community, giving access to the PCR tests. We do request if your child is actively ill to go to N3 Labs, because we really don't want to bring people who are symptomatic and ill onto our campuses and potentially expose others. And so N3 Labs is set up in such a way that it limits that exposure, and it protects the community. So yeah, that's another really great option.
And there, we are recommending an appointment at this point with N3 Labs, correct?
Yes, we are. You can access appointments right on our district website. If you click through where it says community testing for N3 Labs, you can sign up for an appointment right there. And just to differentiate one other thing about those two sites, the testing that we're doing at our schools is only for students and staff. The N3 Labs, anybody in the community can access that testing. So a little bit of a difference there, but an important one.
And my understanding at this point with N3 Labs is when you go on to their website, you can access testing locations in Napa and also in St. Helena. And there are quite a few locations and options.
Absolutely.
Yeah. Okay. Well, you mentioned it already. We talked about the masks. We still expect everyone to wear a mask. We still expect everyone to keep distance when they can, and to continue washing their hands. Those have proven to be the safety protocols that have really helped us to keep our schools, our classrooms open, and that truly is our focus right now. Let's keep these schools open. Let's keep our children and our employees here. So Kate, did we miss anything? Did I miss anything? Any more updates that you want to give at this point before I open it up to any potential questions from our watchers, our spectators, our participants?
You know, I don't think we've missed anything on this. I would just like to acknowledge that this last 2 weeks, it's been a challenge. There's been a lot of guidance changes that have come upon us quickly, and it's to be honest, it's been confusing for everybody. And so, you know, I appreciate everybody bearing with us on that. And, you know, we continue to move forward.
Right, absolutely. And thank you, Kate, for all of your work. Okay, I'm going to go to our participants, our attendees, and see if we have any questions. Yes, Carolyn Sanders, I believe you are unmuted now. Let's see. Let's see. Oh, hang on. Yes.
Okay.
Yeah. Hi, Carolyn. What can we do for you?
My quick question is, what is the lifespan of the KN95 masks and the surgical masks? Can I use my KN95 more than one day or more than 1 hour? Or sometimes I've seen kids wearing their cloth masks that haven't been washed for more than multiple days. What would you recommend?
It's a great question. And the KN95 masks, you can rewear them for up to 5 days. With small kids, that can be a challenge. Kids can be harder on some of their equipment than adults. So they are effective for up to 5 days. The surgical masks, the lighter masks, I would say I would use those one a day. Mm-hmm. And absolutely, if you're wearing cloth masks, they should be washed every day.
Thank you.
Right. And especially if they're wearing these medical masks and they're choosing to wear them outside when they're, you know, exercising, for sure.
Absolutely.
Thanks, Carolyn. Any other questions from our attendees or participants? And Kate, I'm just going to give it a quick second because I want to make sure that we.
Absolutely.
I'm not sure. Kendall, you appeared on my main screen. Do you have a question?
I do not. I apologize if I put my hand on accident.
That's okay. You know, Zoom does strange things at times. So, so I just want to make sure that all questions are answered. Well, Kate, any closing comments about safety protocols, health and safety, the Omicron surge, anything you'd like to share with the community as we close this up?
You know, mostly just thank you for everything that you are doing. It has been a rough couple of weeks. I would like to think that that there's a light at the end of the tunnel here. But everything that you're doing, sending kids to school with masks, asking great questions, helping us, you know, really keep on our game has been really a great support, and I appreciate all of it.
Yeah. Thanks, Kate. And on a side note, as superintendent, I did want to just give a comment with regards to the requests that I've received about volunteers in the classroom, because we have not allowed volunteers up to this point, and as we are working through this surge, I am going to continue to disallow that volunteer to come into the classroom, where I continue to watch it closely. I'll monitor it closely. And at some point here, I suspect that we'll be able to. Those volunteers that would be coming in would need to be vaccinated and show proof of vaccine, because I wouldn't want to put any guests at danger. And so just know as a community that the things that I know our community loves to do, be in the classroom, support students, and participate, we're keeping a close eye on when we can allow those types of activities again. Okay. Anything else, Kate?
I think that's it.
All right. Thank you again to the entire community for everything you do. As I walk through the schools, I visit classrooms, your children are really resilient. They are following the guidance, and our teachers have found creative and exciting strategies to bring their classes together and engage them in ways that I just haven't seen before. So it is working. We are open. We want to stay open. So as you know, I'm going to say, continue to wear your mask, continue to wash your hands, and continue to stay distant when you can. Thank you, everyone. If you have further questions, or if someone didn't, if you weren't a part of this and you have a question as a result of this video, feel free to contact your site administrator, contact Kate, or contact me directly. Take good care, everyone. Have a good day.